Each year, nearly 14,000 women are diagnosed, and sadly, about 3,000 will lose their battle with breast cancer in New York State alone. Also, 1 in 8 women will develop breast cancer throughout their lifetime in New York State. Well, today we're doing a 3-part series on breast cancer, and our focus is to educate you on the symptoms and signs of breast cancer. Joining us today is Dr. Christine Risk from Roswell Park Cancer Institute, and she is the Assistant Professor of Oncology. Welcome, Dr. Risk.
Thank you so much, Nicole.
Thank you for taking time to join us today. I know you have a very busy schedule. But first, could you just talk to us about what is breast cancer?
Sure. So breast cancer is the most common cancer of women, and it can be as obvious as a lump in the breast, or it can be completely silent, and a woman may never know that it's there. And it's really important that in those women that they get mammograms, and really in all women, that they get mammograms, because as I said, sometimes a woman can have breast cancer and there can be no visible sign of it.
So if a woman has breast cancer, are there any signs or symptoms that she could look out for?
Sure. So the most important thing is, I tell my patients this all the time, one breast needs to look like the other. And if it doesn't, we need an explanation. So for example, I tell women, once a month in the shower, before you dry off, when the skin is wet, you want to just put your arms up in front of the mirror and look. And a lot of women are very nervous about doing a breast exam, and I don't know what this lump feels like or what this means. And if you don't even want to do a breast exam, at least have an awareness of your body. So what to look for specifically? Well, you want to look for any rashes that are not going away. You want to look for any dimpling in the skin, where the skin looks like it's being pulled down. You want to look at the nipples. Most women, their nipples are pointing out. If you see a change, like maybe one of the nipples looks like it's being pulled in, we call that nipple inversion. That would be something that you want to bring to your doctor's attention. Now, again, that knowing what you have is so important, because some women, have naturally inverted nipples. The nipples, naturally point in, and that's fine. The key is the change. So if you are outgoing and then, one or both turn inward, you want to bring that to someone's attention.
You figure that could be a problem.
Absolutely, because it's a change.
The most important thing you're saying is to know the baseline, right? So you need to know what your body's
Bingo.
like normally to see a change.
Bingo. Other things to look for, certainly any fluid from the nipples. Again, not necessarily breast cancer, but can be a sign of it, so you want to bring that to your doctor's attention. If you have particularly large breasts, you want to make sure that you lift up the breast and look on the undersurface, because if you're just looking in the mirror, you'll never see that bottom end.
Right, you're not going to see
breast.
under the crease.
Precisely.
So do you often find women saying, well, I'm examining my breast and I feel some lumps in here. Is that normal?
Absolutely. The overwhelming majority of women will feel some lumpy bumpiness to their breast.
What is that?
That is all of what we call the glandular tissue and the fat. Remember, if we think about what's in a woman's breast, it's really 3 things. It's fatty tissue, milk glands, and milk ducts. And we get fooled into thinking that it's this, nice, smooth, like a hard-boiled egg type of surface, but it's really the farthest thing from it. And the best analogy I can give you is that, remember when Oprah gets out her, 20-pound bag of fat?
Yes.
And it's this lumpy, bumpy thing.
Right.
As I just said, most of a woman's breast, especially as women get older, is fat. So it is pretty lumpy, bumpy. Again, the key is knowing what you have, and also symmetry. If you feel a lumpy bumpiness on one side, you should feel it in the same area on the other. And if you don't, never be shy about bringing that to your doctor's attention. If there's any question, it's better to be, more proactive and have your doctor tell you don't worry about it, or maybe get an ultrasound, versus ignoring something that you're worried about or you think might need attention.
I also want to get some clarification on lumps
Sure.
under your arm,
Sure.
because I've heard that. Is it possible to have, breast cancer under your armpits, or find some type of lump there that could be breast cancer?
Sure, of course. Great question. So a couple things. There is what we call the axillary tail, and that is actual breast tissue that extends towards the armpit.
Okay.
Some women will also have breast tissue, what we call ectopic breast tissue, which is actual breast tissue but is in the armpit itself.
Okay.
More than not, when a woman, if we feel something in the armpit, the biggest question is it a lymph node? Because that's the more likely scenario. And is that lymph node abnormal for any reason? Meaning, is there potentially any breast cancer that may have spread there? So that's really the heart of the issue. But, you know, there can be all kinds of other things there as well. There can be cysts and, you know, all kinds of little abscesses. So, again, if you feel something underneath the arm, it's new, you've never seen it or felt it before, certainly bring it to someone's attention immediately.
What if it's something that comes and goes? Like maybe once in a while I'll get, you know, a little swelling under the armpit. Should I be kind of alarmed about that?
So the women, you know, a lot of times we think our breasts are just, you know, kind of static, but they're really not.
They change a lot.
They change a
Age.
lot. Age,
weight gain and
weight
loss.
gain, weight loss. You're absolutely right. Pregnancy can do it.
Yes.
Even cyclic hormonal variations. Certain times of the month, the breast can be much lumpier.
Oh, that's a great point. When you're having your menstruation, you change. Your body
Absolutely,
changes.
absolutely. So the key there is, again, feel it, note it, kind of keep an eye on it. If it comes and goes, great. If it comes and stays,
Not so
and
good.
it's staying longer than the variation,
Yeah.
again, that should be brought to someone's attention.
While we're on the topic of, you know, breast screening, what are the 3 different breast screenings that we could do?
Sure. So first, it always starts with a physical
Right.
exam. And again, if you're not examining yourself, your gynecologist or your primary doctor should be doing that at least once a year. And this is now talking about the average woman, meaning no family history or personal risk factors for breast cancer. And we can get into that in a little bit. But other than that, from physical exam, you want to make sure that you get a mammogram every year once you turn 40. So 40, 41, 42, and keep
Every
going.
year.
Every year. Don't miss a year.
Why would I get it before the age of 40?
Sure. The great question, and the simple answer to that is if there is a family history or if there is a lump or a bump that we are trying to figure out what exactly it is.
Okay.
So just a word on the family history. If we have a woman who has a first-degree relative, meaning a mother or a sister or, God forbid, a daughter who's had breast cancer, and say she was 42 at her time of diagnosis, then we recommend that a woman is screened 10 years earlier.
Okay.
But that's your immediate family. If you have, you know, an aunt or, you know, a cousin, not so much, but that first-degree relative diagnosed, you know, premenopausal, you want to begin 10 years prior to that age of onset. So as I said, if some, you know, mom had it at 42, you should start maybe even potentially at 32. The reason that we're not keen on getting mammograms in young women is that, and you know, young is progressively getting a little bit
Yes.
more generous, but you know, 40-year-olds, 35-year-olds, certainly anything younger than that, is that the mammogram is actually not very helpful because there's less fat in the breast, and in general there's a lot more milk glands and milk ducts.
Okay.
And that can be very difficult to interpret on mammogram. You see this white cloud, and it's very hard to really get a good picture of the breasts when they're so dense and there's not a lot of fatty tissue. As a woman ages, however, more fat, easier to read the mammogram, often a better picture.
Okay, so we have the self breast exam, we have the clinical breast exam, and then we have the mammogram.
We do, and just a word on MRI, sort of a lot of folks out there wondering about MRI, who gets MRI. You know, no official national guidelines are set yet for MRI.
Okay.
It's sort of at the discretion of your doctor, and in certain situations, again, women with a significant family history, women with a personal history of some risk factors that we can get into. But in general, for the general population, we would not recommend MRI for everyone unless there's certain circumstances.
Let's definitely get into the risk factors. What are the risk factors for breast cancer?
Sure.
You said there's a history in your family. That's one.
That's one. You know.